Hello everyone. Today we can see the difference between placenta previa versus abruptio placentae. As we know, these are the two major causes of antepartum hemorrhage. What is meant by antepartum hemorrhage? Antepartum hemorrhage is defined as bleeding from the genital tract that occurs after the 20th weeks of pregnancy till the birth of the baby. Now we can see the difference between placenta previa and abruptio placentae. Placenta previa, where the placenta is implanted in the lower uterine segment, which is covering the cervical os partially or completely. Its onset is usually during the late pregnancies. The bleeding will be bright red in color and pain will be absent. On palpation, the uterus feels soft and relaxed. Usually, the fetal condition will not be affected. If the mother is developing heavy bleeding, the fetal will undergo fetal distress. Risk factors: previous cesarean section, multiparity, the mother who had been delivered 2 or more times. When the advancing maternal age over 35 years are at the risk of developing placenta previa. Multiple pregnancy is also known as twin pregnancy. Smoking. Because of smoking, there will be a constrict of uterine wall which will cause the placenta to be implanted in the lower uterine segment. Management: adequate bed rest, avoid vaginal examination, monitor the mother and the baby closely. If the mother is having severe or recurrent bleeding, immediate C-section can be done. Hemorrhage, anemia, preterm, or the complications of placenta previa. Now we can see placenta abruptiae. It is premature separation of normally implanted placenta from the uterine wall before the delivery of the baby. Its onset is sudden, most often before the delivery of the fetus. The bleeding will be dark or concealed bleeding. Concealed bleeding is the blood will be collected between the placenta and the uterine wall. The mother will be experiencing severe abdominal pain. On palpation, the uterus feels tender and rigid. Fetal distress is common. The mother may develop shock quickly. Risk factors: hypertension, trauma due to fall, smoking, substance abuse, sudden decompression of placenta. Management: after stabilize the mother, if depending upon the severity, immediate delivery can be done. Complications: disseminated intravascular coagulation, fetal distress, fetal death, preterm labor, maternal shock, or due to the lack of oxygen supply and nutrient. Preterm labor due to premature separation of placenta, maternal shock due to excessive bleeding. Nurse's responsibility: you have to monitor the vital signs and the fetal conditions frequently. Assess the amount and the nature of the bleeding the mother has. Ensure the mother have IV access and fluid. Provide emotional support to the family and the mother. Prepare for emergency care. Tips to remember: in placenta previa, painless bleeding will be there. In abruptio, painful bleeding will be there. Early recognition and immediate intervention, we can save the mother and the baby from the condition. Thank you all.